Chest X-ray, CT scan, chest interpretation, air crescent sign. You are seeing a CT scan image in lung window taken at the level of aortic arch. This is obviously left lung, clearly showing more than one abnormality. In the posterior part of the image there is the fluid density. In the middle there is a lesion that does not have clear or smooth boundaries. Moreover, it has an air density trapped within it, which is making a crescent shape, early moon. This sign is known as air crescent sign and can lead you to a very definite diagnosis. Air crescent sign is defined as a crescent shape air density within a mass or nodular opacity, and the pattern can be visible on plain chest x-rays as well as CT scans. Some cavities will have more than one crescents. This sign most frequently, if not always, indicates fungal infection, which is also known as mycetoma or fungus ball. Some people will simply call it aspergilloma. If you were to do a biopsy and look at the specimen microscopically, such cavities will have mucus, fibrin, necrotic tissue and cell debris. Presence of air is the result of phagocytosis from white blood cells which create a space towards the edge of the cavity. This space is occupied by air to create an air crescent sign. Mycetoma or aspergilloma is found in patients with compromised immune system or with underlying lung conditions such as tuberculosis or sarcoidosis. This happens because of inhalation of fungus as spores from open environment, just as people inhale bacteria and viruses. In healthy individuals, this does not cause any problems because neutrophils and macrophages, that are two white blood cells, can easily take care of such invaders. However, in patients that do not have a strong immune system, this becomes a problem as fungus grows to make a colony. In patients with tuberculosis, now tuberculosis patients have cavities already within lungs, and these spores can actually go into those cavities where they do not have any contact with white blood cells, and they can easily grow these as colonies without being taken care of by white blood cells. Now, if I'm not wrong, this is a bronchial branch, and there is a communication channel, and this channel is supplying air to this cavity. And mycetoma can also be angioinvasive, means they can damage blood vessels and cause hemoptysis. Hemoptysis means coughing up blood. Hemoptysis is the most common symptom of aspergilloma or fungal infection. This hemoptysis can become life-threatening. However, some people can live with such cavities for years without any symptom. Antifungal treatments are available to treat such patients. Sometimes surgical removal is necessary. Chest X-ray PA view and lateral view showing a fungus ball and air crescent signs. This is a bit more clear. So this is the mass and air crescent signs. Another set of images. Two CT scan slices of right lung, and the air crescent sign is present. This patient was given antifungal treatment and the air crescent sign is developing here. CT scan chest monode sign. A single CT scan slice through chest at the level of aortic arch. This is arch of aorta here. The image is in a lung window. However, left-sided pleural effusion is clearly seen, which has moved towards the posterior thorax. Because of the gravity, as the patient is supine, the fluid is heavier than the lung tissue and it moves towards the gravity. There is no pleural effusion on right side. The other clearly visible pathology is this round mass surrounded by this black density or air density. The presentation, which looks like a moon with a halo around it, is known as monod sign. Monod sign most commonly represents the presence of fungus ball, which is also known as aspergilloma or mycetoma. Outside this fungus ball or lesion, you can clearly see consolidation, which is diffusing out around the lesion just like a halo around moon. This represents hemorrhage or blood in plain English within the surrounding tissue. You will typically see such pathologies in upper lobes. This sign should not be confused with air crescent sign. There are streaks or streak artifacts in the area of superior vena cava. This probably represents the presence of central line. You can also see something here, so probably it's a PIC line, but you cannot certainly say this on just one slice. It is not clear whether the image is contrast enhanced or not. Sometimes contrast can also produce streak artifacts. That's all for now, but we will certainly use this image again to describe a few more things in future. This is a very interesting image. The image has been copied from RedWiki with and thanks very much to whoever uploaded the image. Thank you very much.